colostrum feeding is equivalent to fast immunization of newborn. ওদের explain why এসছে, আমাদেরকে জিজ্ঞেস করছি কি লিস্ট পয়েন্ট বলবে। একটা আইজি এ আর ইমিউনাইজেশন মানে কি অনলি সির্ফ মনোক্লোনাল অ্যান্টিবডিজ, আর কি থাকতে পারে যেটা গিভ ইমিউনাইজেশন ইজ প্রোটেকশন না, আর কি থাকতে পারে যেটা হচ্ছে গিয়ে প্রোটেক্ট করছে মানুষকে, বাচ্চাকে? এনিথিং এলস? ইয়েস, ইউ আর সেইং সামথিং, বাট ওকে, অন্যদিকে তাকিয়ে দিচ্ছে কি বুঝতে। What you are saying? What you are saying? Except nutritional value. What? Vitamin, minerals, carbohydrate is how giving immunization. Energy production. Is there any proteins in what protein? Okay, you are going right. When that's what I am saying. That when you are writing for explain why in your own exam, think not only the obvious answer, think as a whole. IGA will write everyone, okay? 90% of all of the MBBS students appearing in the final MB, they are writing that, and they will get the average number also, okay? Because these things, what you said, that vitamins, what vitamin is in the breast milk and which is not present? What vitamins are present and what is not? কি হলো? What is not? Vitamin C present. And what are the fat soluble vitamins are present or not? Yes, no টা খুব ভালো আসছে, একটু ভাবো না, একটু ভাবো ভেবে ভেবে একটু করতে এখন থেকে পড়ো। ওকে, আর একটা কোশ্চেন, তোমাদের এএফপি সার্ভাইলেন্স তো তোমরা জানো, সেখান থেকে এমসিকিউ এসেছিল। ইন এএফপি সার্ভাইলেন্স স্টুল আইডিয়ালি শুড বি কালেক্টেড ড্যাশ অফ অনসেট অফ প্যারালিসিস। Within how many days of onset of paralysis stool samples should be collected? 48 hours. Nope. Okay. In AFP surveillance, stool ideally should be collected of onset of paralysis within how many days or hours of paralysis? I am giving you the options. First option within 24, second within 7 days, third within 14 days, last option within 28 days. So 48 was not even in the option. Yes? 14 days. How many samples? 2 samples, 24 hours apart. So there was no 48. Koplik spot is pathognomic of measles, mumps, rubella, HIV. কোথায় দেখতে পাওয়া যায়? What is the site? গামের পেছনে কিছু দেখা যায়? Gums, chewing gums. Okay, Koplik spot, very good. Which of the following measures wasting in children? Weight for age, weight for length or height, height for age, upper segment is to lower segment ratio. At least এখন ফ্যামিলি প্রচুর ব্যাচের হয়ে গেছে। Height by weight, weight for height. আর and then what is stunting দেখার জন্য? Weight for height and height for weight, দুটো জিনিস তো একই লাগছে শুনতে, ঠিক করে বলো। Height for স্টান্টিং, হাইট ফর এজ। আর ওয়েট ফর এজ তাহলে আমরা কি দেখি? ওরা আমাদের এমসিপি কার্ডে আছে, খুব ইজিলি আন্ডার নিউট্রিশন আর আন্ডার ওয়েট ডিটেক্ট করার জন্য। ঠিক আছে, ওয়েট ফর এজ যদি দেখা হয় তাহলে আমরা কি দেখবো? আন্ডার ওয়েটই পাবো, আর কি কিছু পাবো? ওকে, কামিং টু টুডেজ topic, that is local custom and practices during pregnancy, childbirth and lactation and feeding practices. Okay, why this section? আমাদের লাইফের প্রত্যেকটা স্টেজে, in every stage of our life we are attached to some customs from birth to death. Why these sections, practice and customs are that much important? Can why we are only focusing on only childbirth, child care and also child nutrition? Why? Because they are the most vulnerable. I told in last class, mother and child, they are the most vulnerable. And also what you said, for development of any area, this section should be of our utmost importance. In your last MB there was a explain why, I think not all customs are bad or something like that, na? Last MBBS examination, that was question. So there, if such questions like that came, what you have to say first, that give the definition of the custom. Okay, so what is customs? They are the established and traditional practices, behaviors and rituals that are commonly followed within a particular culture of particular society. Very simple. Okay, do not, there is no scientific word or everything, simple definition, try to remember it. Okay, that these are the established, obviously age old, and that is similar to traditional. And what are the customs? They are some practice, they are some behaviors, and also they are some rituals. Those are commonly followed. And then coming to the local custom and practices. If the word local is adding, then we are particularly referring to a specific population, specific area. That is, what are the local customs? They are traditional and widely accepted ways of behaving and doing things that are specific to a particular area, region or cultural group. Local practice also same thing. Okay, these are the behavior, these rituals, beliefs and behaviors related to pregnancy, childbirth and early child care. So what are those? What are the features? If they ask, just only 3 points. They are passed down through generation, similar to traditional or age old. They are deeply ingrained in the local culture. It's an important point you have to remember. And it can play, it can vary significantly from one society or one cultural group to another. What is the rationale behind understanding custom and practices? Because that was the question, some of them are good, some of them are bad, we need to identify. And at a prochur reel, now we are seeing a very common reel that we in our doorstep or some car there were lemons and green chilies are pierced together and kept together. What is the reason? নজর না লাগে, ঠিক আছে। তারপর হচ্ছে গিয়ে কিছু আমাদের মুভি রেফারেন্সেও আছে, ঘোস্ট থাকলে লেবুটা লাল হয়ে গেল, হ্যাঁ তাই না? বাট হোয়াট ইজ দ্য অ্যাকচুয়াল রিজন? অক্সিডেশন। সিম্পল থিং, লেবুতে থাকে সাইট্রাস অ্যাসিড, ঠিক আছে, অ্যান্ড নাও অ্যান্ড অলসো গ্রিন চিলিতে capsaicin. If they are highly volatile chemicals, if they are mixed into air, evaporated into air, they are act as a insect repellent. That's why when we are piercing, the sap is the nectar or sap, what you said, that is coming out, getting into air, getting into evaporated, and everything. So that's why we need to change it in every few days, 3 days, 7 days, whatever the value. But what we see now, that ekbar lagano holo to they are not getting replaced. That is a bad thing. The ritual started with a scientific reason, but the science was not explained. So, in ways, in tradition, in generations, it became a just practice. So that's why it is not working. And citrus acid is a very good insect repellent. In our that mosquito sticks are na, the canteen হচ্ছে কি আমি all out খুঁজতে গিয়ে আমাকে ধূপ ধরিয়েছিল প্রথম। হ্যাঁ, আলো রেখে দাও। What is the main ingredient in those? That is citrulline. Okay, it's an artificial analog of citrus acid. Because normal citrus acids are getting evaporated quickly, so we need an analog which can act like same and also not getting evaporated easily. We need heat. That's why we have to burn those incense or agarbattis. But what was the adverse effect? That citrulline is a very bad chemical and acts as a carcinogen in higher dose at long term use. So if we now use the lemons which are easily available, if we know the reason, we will use those. Okay, that's why this is also one example. Okay, some customs were good, some were bad. What was the reason? We forgot the science, or that was not told to us. Customs and practices related to pregnancy, childbirth, lactation vary widely across our India. It's a nation of many beliefs, many things. Okay, local. So we are not now dividing the total duration into 4 separate phases. That is pregnancy, childbirth, lactation, and feeding practices. Also, the pregnancy is getting divided into 4. That is first trimester, second trimester, third trimester, up to birth. Now, what are the local customs during pregnancy? During prenatal care, we usually follow that prenatal mothers should not go outside, they should be very much cared for. Is that a good custom? What do you think? They should be cared after in the early pregnancy. Is that a good option? Very good option. But if that comes to, if the woman is working, the working woman, then her mother-in-law is saying, don't go outside, don't do this, don't do that. What will she feel? That she is trapped. That's why we need the cause to make her understand why she should be cared after. Why? Because early in the pregnancy there might be a spontaneous abortion. So if she is not careful, the child might get aborted. The fetus, the fetus might get aborted. Also for diet, there are some dietary practice. Specific foods are often recommended or avoided. For example, in some culture, eating certain fruits or vegetables is believed to promote a healthy pregnancy. And also some foods such as papaya and pineapple are traditionally avoided as they are believed to induce contraction. Pepe, even in West Bengal, in some areas such as Singur, okay, that was my practice area during my PG seats, okay, the field practice area, just like Nanur for yours. There were some custom, not only these papaya and pineapple, even jackfruits. Jackfruits are avoided early in the pregnancy. That was the custom. We can only get that there was a custom among some villages that those jackfruits are avoided in the prenatal of pregnancy. Okay. Why? They also do not know. Is there a scientific reason? I don't know. Okay. It might be, some of you might research it later. Okay. And also there are some rituals and ceremonies. Some cultures have ceremonies to bless the mother and unborn child. Example includes baby showers in Western culture and Godbhara in Northeast India. In our Bengal, Sadhbhakhon. Is that a good thing? Why? Why? এই পেছনে এত গল্প কেন? Why Godbharai or baby showers are important? Because we all know that during pregnancy, the mother needs extra nutrients. How much? Those who have already completed family visit should answer this. Out of 150, at least 120 তো family হয়ে গেছে। কত কিলো ক্যালোরি এক্সট্রা লাগে? 350। আর ল্যাকটেশনের সময় ডবল। কত হচ্ছে ডবলে? উত্তরটা 600। So we forgot the exact reason. That's why we only one day we are giving, when she needs every day some extra care in the late in the pregnancy. Usually these are giving at the late of the pregnancy. Also exercise and physical activity. Here guidelines on physical activities varies, but moderate exercise is generally encouraged. This is also customs in some of part of our country. And where medical interventions, the use of prenatal vitamins, ultrasound scan and genetic testings are common practices. Okay, not the genetic testing now. Okay, but USG and prenatal vitamins, these were the common practice. USG is sounding somewhat that which section of the country is that much modern, but it is seen in some part of our southern part of our country. Okay, they make a calendar when to do USG, they remember that. Okay, USG কখন কখন দরকার হয়? What is the usual date of anomaly scan? First visit হচ্ছে গিয়ে একটা হতে পারে anomaly scan, specific এইগুলো তোমাদের MCQ তেও আসে। When what is the usual date of anomaly scan? What is the usual time of triple test? What is the usual time of quadruple test? কেন অবশ্যই বোঝা যাচ্ছে anomaly মানে we are detecting congenital anomaly. And what we are finding, which finding shows which kind of anomaly. Okay, if nasal bone is missing in USG, what is the usual diagnosis? Down syndrome. Okay, but that is suspected. Hote pare that person is from northeast of India. There the nasal bone is very much small. Okay, is the baby Down syndrome? So what we have to do then? Go for karyotyping. What is Down syndrome? And also there are some cultural beliefs in our country that resting extensively during pregnancy is mandated, which is seen in our state. Okay, here we are also very lazy. We are not exercising in our normal days. Look at me. Also there are myths and beliefs that buri nazar agar nahi lage to what to do? We kept the female in the under the curtains during pregnancy. So what they are missing? Vitamin D, which was easily available. Now we are have to giving supplements. Giving calcium supplements is also bad for the fetus. So there is a very problem. And also astrological consideration. 2011 সালে 11ই নভেম্বর record number LSCS happened. Okay, highest number of caesarean section in our country of the last decade happened on 11th of 2011. Okay, because they all want to their child to be number one. Mera number one, sabai bujo. They also wanted that things. Okay. Previous class I talk about water birth. That is also one customs. There are also local dyes and many things. Even birthing locations. Some traditions in our Western India, they prefer hospitals. Also again in some Western India parts, that is Rajasthan, they prefer their home. Okay. In our Bengali also there was previously a specific term, that was Aturghar. Okay. That was a closed, there only one door, no window, inside is very hot. They think like that because the baby need warmth. But what happened? Without ventilation there was high much concentration of carbon dioxide. So the baby got warmth but also got hypercarbia. So there was problem. Also there are some local custom for birth attendants. The presence of midwives and family members during birth is common in various cultures. Okay. All you have heard about LaQshya. LaQshya, that is the improvement that is launched by Government of India to improve the quality of the labor room. Okay. One part of that, previously in labor room we are not allowing any one of the family members, no one should be allowed. But now Government of India is saying no, one female member of the family can be present in the labor room if there is no separate rooms are available. But if separate rooms are available for each patient, even the husband can be present. Okay. Western ইয়েতে আমরা দেখে থাকি যে হাজবেন্ড থাকে, তাই না? কিন্তু সেটা এখানে সম্ভব ছিল না। কেন ছিল না? লেবার রুমে একজনের পাশে আরেকজন মাদার আছে, ঠিক আছে? কোনো অবস্থাতেই কোনো ছেলেকে তো অ্যালাউ করা যাবেই না, অন্য বাড়ির অন্য কোনো মহিলাকেও অ্যালাউ করা হতো না ওই জন্য। বাট ইট ওয়াজ ক্রিয়েটেড আনফ্যামিলিয়ার environment for the mothers. Okay. That's why now we are mixing that ritual with our own national plans, that is LaQshya. Also there are much more other rules and regulations for LaQshya. Okay. If your labor room is following LaQshya, you will get a certificate. Please read LaQshya in your textbook. Okay. It is available in park. Also there are some local practices during childbirth, pain management. Water birth is usually for pain management. There were also sipping of dry ice or ice cubes. That was also one customs. Also there are in medical procedures, common practice include using caesarean section. Okay. There is a audit. Okay. You know what is audit? Understand what is audit, na? Audit is nothing but hisab rakha. There was one audit, that is caesarean audit. Usually caesarean audit hocche ki rakha hoy, it is kept to how much deliveries are going by LSCS, how much deliveries are going by caesarean section. What is the general rule for any obstetrician or gynecologist? That we will not go by caesarean section if not it is indicated, but it is very much not followed in the private setup. There was choice for the mothers, no, I will not go by normal delivery, I need LSCS. Is there any difference between caesarean section and normal delivery born babies? Is that taught in your gynae or obs? Okay, read there. What is the last phase of labor, last phase of pregnancy or last labor? what is the advantage and disadvantage of going through normal delivery. Okay. Also for postpartum care, there are some practices which include monitoring the mother and baby for complication, promoting skin to skin contact and breastfeeding support. You all know about the kangaroo mother care, na? That is skin to skin. And also there are some myths and superstitions related to mother. Eclipses, it is believed that a pregnant woman should not step out during solar or lunar eclipse to avoid the harm of that baby, such as birth defects. Can any of you find a logical reasoning behind that? Why? কিছু নেই না, তাহলে নেই কেন করেছিল আমিও জানি না, but it is followed in all over India. Activity restrictions, I talk about that. Food restrictions, also I talk about that. Gender prediction, okay. Various methods such as shape of the belly, cravings and the way a woman behaves during pregnancy can predict the gender of the baby, okay. Some of it I seen in the labor room. Some babies are kicking too much inside the womb, obviously it's a boy, okay. If the mother is too much happy during the pregnancy or the last days of the pregnancy, it's a no, sorry, that's also a boy, okay. If the shape of the belly is not round, somewhat ovoid, okay, sorry, we are all predisposing, these families are all predisposing to boys. So what we are thinking is each and every side it will be a boy, okay. Believe it or not, I have seen some mother also get crying, family members get crying, because in government hospital you can see every aspect of the society, they are starting crying. Mother is also crying. Why crying? Because oh, I have to get pregnant again, okay, that's why. Also for the what are the myths and superstitions relating to baby? Evil eye nazar, that's why what we give kala tika, kajol হয় না কখনো চোখে কখনো কপালে, ঠিক আছে. Also naming and horoscopes, some believe that casting the baby's horoscope immediately after birth and selecting a name based on astrology can influence the child's future. Same, that 11-11-11 syndrome, okay. And also first outing, the often believed that baby should not be taken out of house for a specific period, usually 40 days, to avoid the exposure to negative energies. I don't know about 40 days. Why 40 days? I can find similarly to that puerperial period is 42 days, okay. The mother should need rest. When the mother is ready, mother only will take the child. That is my thinking. I don't know who predicts that 40 days exact, okay. And there are myths and superstitions related to childbirth process. Labor induction, certain rituals and practices are believed to induce labor. For example, some might use specific herbs or perform religious rituals to ensure a smooth delivery. It is very varied. Some is also present in Bengal, okay. Also birth position and time, this is the exact 11-11-11, okay. Position and time, everything should be there. Placenta disposal, the handling and disposal of the placenta are surrounded by various rituals. In some communities it is buried in a specific manner to ensure the baby's good health and future, okay. Sometimes it is buried in the home, in the একটা গর্ত খুঁড়ে অনেক পুজো পাঠ করে তারপর হচ্ছে গিয়ে সেটা চাপা দেওয়া হয়, ঠিক আছে. কোথাও হচ্ছে গিয়ে সেটা, if there is a also a woman who is yet to become a mother or not becoming mother for a long term, it is given to her to also to bury in their own backyard, okay. So tomar you are not getting pregnant, you are married for many years, so take it, bury it in your backyard, you will be pregnant very soon, okay. Also postpartum myths and superstition, again that confinement period. Postpartum diet, certain foods are believed to help with recovery and lactation while others are avoided to prevent health issues. Again the same, those fruits, pineapple, papaya, sometimes jackfruits, these were involved. Bathing practices, the first birth of the newborn is often done by a traditional birth attendant or an experienced female family member with specific rituals to ensure the baby's well-being. This is usually found in the western part of the India, okay. It has a name also. And what are the local customs and practices during lactation? Breastfeeding, initiation of breastfeeding is often occurs within the first hour of the birth. It's a good thing. What is the usual time of initiation of breastfeeding if it's a normal delivery? As soon as possible. If it's a cesarean section, as soon as possible. Look for other options. Sometimes it's given as 1 hour, 2 hours to gain the mother's consciousness. Okay. The question is usually asked as a what is the normal delivery. However, colostrum is also highly valued. It is seen in our Bengal. Okay. Colostrum is highly valued, and mothers are encouraged to breastfeed exclusively for the first 6 months. It is not seen. However, in some communities, colostrum may be discarded due to traditional belief. In the middle part of our country, they discard it because they think it's as a bad thing. It will cause harm. Okay. And also the duration, exclusive breastfeeding is promoted, encouraged in some part of our India, but in some part the child is given cow milk or anything else sometimes. Okay, cow milk is much preferred, or buffalo milk also, because they thought it will give the strength to the child. Weaning practice, the timing and method of the weaning is very widely. Some cultures practice extended breastfeeding while others prefer solid food earlier. We, in our Bengali tradition, we have some ceremony. Is that good or bad? It is usually different for male and female also, you know na. For male it is 6 months, female it is 7 months. What do you think, it is good or bad? আমাকে খাওয়াচ্ছে দেখে ওরা একা তো খায় না, obviously good. For me it is good. Okay, free meal is always good. It's a good thing because we are following the exact timing for the male child but not for the female child. Why that I don't know. Okay, diet and nutrition also, there are lactating mothers are often advised on specific diets usually rich in protein. That's a good thing to ensure adequate milk production and nutritional quality. Health monitoring is also a good thing. Usually lactating mothers' health is too much valued in the family. Okay. For colostrum, there are some myths also that it's in some communities it believes to be dirty and harmful, leading to its discarding. Instead, newborns give sugar or honey water, or sometimes jaggery also. What do we know it as? What do we know the practice that giving honey, sugar water or other substance, initiation of initiation of breastfeeding, giving to that, what is the term? Also there are some myths and superstition related to milk production. Some mothers thought that we are not producing enough milk because the baby is crying always. Also there are some food and drinks that are encouraged to give that, such as consuming ghee, fenugreek seeds and specific herbs is thought to boost milk supply of the mother. Okay. Water consumption, some believes that drinking water immediately after childbirth can dilute the breast milk, reducing its quality and quantity. Is it possible? No. And also there are myths for breastfeeding duration. In some communities there is a belief that breastfeeding beyond a certain age can spoil the child. Is it true? It's a assertion reason. There are two statements that in breastfeeding beyond a certain age, example 1 year is bad, that is assertion. Reasoning, it can spoil the child. What will be, and there was some options that A, both true, and R is the exact explanation of A. Second is B, option B, which is both true, but R is not the exact explanation of A. Option C, A is true, R is false, and D, A is false, R is true. What is the answer? Think. First thing, if the both statements are true. No. Okay. Then what is the explanation? Which one is true? Assertion is true. কি হলো এত ভাবতে বসছে একটু প্রবলেম হয়ে যাচ্ছে একটু ভাবতেই তো বলছি Is the assertion true that breastfeeding beyond 1 year is bad? Assertion true. And is the reasoning is true? Reasoning is false. Then what is the option? Which is the correct answer? C. Okay. Breastfeeding during also pregnancy. There is a superstition that breastfeeding during a subsequent pregnancy can harm the unborn baby. Is it true? Breastfeeding during a subsequent pregnancy can harm the unborn baby. And also feeding frequency. Some believe that feeding a baby too frequently can spoil their habits. No. What is the frequency of feeding in the first 6 months? তাহলে too much যদি হয়ে যায়, is that false? Is that bad? That's a myth. See the heading, it's a myth. I put it in the myth. Also maternal diet, there are some restriction. Also some communities follow certain diets. Okay. Infant health, again evil eye is there. Breastfeeding in the public, it is considered taboo or attracts the evil eye. Okay. Introduction of solid food, that you all said that Annaprasana or rice feeding ceremony, it usually occurs around 6 months of age. What are the common foods we recommend? That is porridge or khichdi, fruits and vegetable, dairy products. Also, what is the feeding practices we try to promote? That is hand feeding, eating with family. Weaning time. What is weaning? Weaning মানে কি? The time and method of weaning. What is weaning? Introduction of solid food and কোনটা বাদ দেওয়া? Breast milk. That is weaning. Eats are often dictated by superstition. Some believe weaning should be done at an auspicious time or after performing certain rituals. It is not Annaprasana. It's different thing. Annaprasana is equal to giving complementary feeding. But weaning is different. Weaning methods also, there are like applying neem paste or other bitter substance in the nipples. Okay. Very bad thing. And also early feeding, some rituals, some societies introduce solid food very early in the age of the child. Okay. Also fast food in many traditions, certain foods like honey and gutti. Okay, gutti it's seen in southern India. Herbal concoctions are given to newborns, even though they are not recommended for infants under 1 year due to health risk. Ghee is not allowed. Okay. Honey also. Or also myths and superstitions about specific food. The concept of food being hot or cold in nature is prevalent. For example, food like curd are considered cold and may be avoided during certain times. শীতকালে আমরা বাচ্চাদেরকে দই খেতে দিই না, হ্যাঁ, ইজ দ্যাট মিথস? অবভিয়াসলি। কেন দিই না? আমরা ভাবি যে দইটা আসলে ঠান্ডা জিনিস, সেই জন্য দেবো না। But we can give that. What we should not give, that is ice cream, because that's fat only, and some of your ice creams are vegetable oils, not even pure ice cream. There was some ad from Amul, okay, that real ice cream is only Amul, and there was actually there was a case in the court where after that quality ice creams are written, okay, sorry, not quality, many, right? These are not real ice cream, these are frozen dessert, it contains vegetable oil, okay. দাদা এই জায়গাগুলো একটু বাদ দিও যেখানে ব্র্যান্ডের নাম নিচ্ছি, হ্যাঁ। Bananas and colds, there are some beliefs that feeding banana to children can cause also colds, feeding banana can also promote diarrhea, but is that correct? But what it causes? Eating banana causes high fiber, so it prevents constipation, also the stool will be smooth. And why they are thinking like that? Because when there is no constipation, the child might defecate too many times, so they are mistaking it as diarrhea. But is it diarrhea? No. That is the thing. Also, chubby babies, in many cultures, a chubby baby is seen as a sign of good health. You all, in paper, there are some giant babies whose, yes, and their mother is also, yes, God gave me this child, okay, it is a boon. But ultimately, we do not follow the news. Usually, 1 or 2 years after, if you try to find the child, you might find that child is dead. Okay, newspaper also did not give usually those news. They only give 1 day picture. Okay, there is a child who eats that much. Okay, their mother's perspective is that and that, and 1 or 2 years later, there was some case actually. Akbar Nam was the name of the child. And also there are some myths of spices and digestive issues. The belief that adding spices to child food can harm their digestion. Is it a myth or a good thing? I put it in the myth. But is it true, na? Giving spices, the child's liver is too much premature. It cannot process the spices. So it's a actually good thing. Feeding practice also, there is a schedule that the baby should be fed at a specific time. Self-feeding is promoted in some culture also, which is a good thing. Auspicious weaning is also there, as I said. Weaning food. There are superstition for diet during illness. What is the usual, if the baby is breastfeeding, during disease, the baby should be breastfed more or less. In the first 6 months of life, if the baby is, the baby should be breastfed more. What I am asking, if the child should be breastfed more or less. There was some deficit, that's why the child got sick, na? And also there are some rituals for teething and diarrhea. Challenges and modern influences, there are malnutrition. Despite traditional practices, malnutrition remains a challenge in some area due to poverty. I talk about the village Amla Sol, came into news. And there is always the Western influence. Water was in India very much earlier, but when some celebrities are promoting it, now Indian women are following it. Okay. Regional variation, there are North India, wheat-based dishes like roti or dal are common. Southern India, rice and lentil like idli or dosa. East India, we are giving fish and rice. In West, a variety of grains, usually with dairy products. And in many households, grandparents follow a significant role in the development of the child, which is a good thing and bad thing depending on the education of the grandparent. Okay. টপিকটা বড় ছিল কিন্তু ওটার থেকে দুটো কি তিনটেই কোশ্চেন হবে, দুটো এক্সপ্লেন হওয়াই হবে অথবা একটা লং কোশ্চেন আসতে পারে। দিস ইজ অনলি ওয়ান লং কোশ্চেন, ওকে, দিস ইজ এ লং কোশ্চেন। Screening of high risk pregnancy in India under national program and RMNCH plus, okay. What is the high risk pregnancy? A pregnancy in which mother, fetus or both have increased risk of morbidity or mortality, that is high risk.